The National Health Insurance (NHI) system is a healthcare financing model in which a single public or quasi-public agency manages healthcare funds and provides coverage to all citizens or residents of a country. Under the NHI system, healthcare services may be delivered by public, private, or mixed providers, with costs covered by mandatory contributions from individuals and employers, government subsidies, and other funding sources. The NHI system aims to achieve universal health coverage, ensuring that all individuals have access to essential healthcare services without facing financial hardship. The NHI system is implemented in various countries around the world, including Taiwan, South Korea, Japan, and some European countries like Germany and the Netherlands. While specific features and structures of NHI systems may vary from one country to another, they generally share common principles such as universality, equity, solidarity, and cost containment. The National Health Service (NHS) is the publicly funded healthcare system in the United Kingdom, which provides comprehensive healthcare services to residents of England, Scotland, Wales, and Northern Ireland. Established in 1948, the NHS is funded through general taxation and provides healthcare services that are free at the point of use to patients. The NHS is based on the principle of universal healthcare coverage, with services provided by public healthcare providers, including hospitals, clinics, and general practitioners, GPs. While both the NHI system and the NHS aim to provide universal healthcare coverage, there are some key differences between the two. Funding mechanism. NHI systems typically involve mandatory contributions from individuals, employers, and government subsidies to finance healthcare services. Funding may come from payroll taxes, social insurance contributions, or general taxation. The NHS is funded primarily through general taxation, with the government allocating resources to the NHS budget from tax revenues. Healthcare services provided by the NHS are free at the point of use, with no direct charges to patients for most services. Service delivery. Under NHI systems, healthcare services may be delivered by a mix of public, private, or mixed providers, with patients having the freedom to choose their healthcare providers. The NHS primarily delivers healthcare services through publicly owned and operated healthcare providers, including hospitals, clinics, and GP practices. While private healthcare services exist in the UK, they operate alongside the NHS rather than as part of the NHS system. Governance and administration. NHI systems are typically administered by a single public or quasi-public agency responsible for managing healthcare funds, purchasing services, and overseeing healthcare delivery. The NHS is governed by the Department of Health and Social Care in England, with separate health departments responsible for healthcare services in Scotland, Wales, and Northern Ireland. The NHS is decentralized, with decision-making authority shared between central government, regional authorities, and local NHS organizations. While both the NHI system and the NHS share the goal of providing universal healthcare coverage, the specific structures, funding mechanisms, and service delivery models may vary between countries. However, they both represent efforts to ensure that all individuals have access to essential healthcare services without facing financial barriers or hardship.